Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Over the past 18 months, public health agencies, special interest health groups, and a legion of public health foot soldiers pumped a fake epidemic of teen vaping and perpetrated a fallacious lie: vaping kills. In just 6 months, we've gone from dramatic daily announcements of new cases of vaping-related lung illness and death to dramatic daily announcements of new cases of COVID-19 illness and death. One hysteria ran into the other, or could they both be the same hysterias? Joining us today to talk about this is Dr. John Oyston, anesthesiologist and harm reduction advocate. He has decades of experience dealing with infectious disease, including frontline experience fighting the SARS outbreak in 2003. As a dedicated supporter of vaping as a tool for harm reduction, Dr. Oyston is tracking the convergence between CDC's hysteria over vaping and the hysteria over COVID-19. Dr. Oyston, thanks for joining us today on RegWatch.
Thank you for having me on the show.
Yeah, I wish it was under better circumstances. I know that a great many in our audience are concerned about the purported impacts that vaping may have on the health of vapers, which could be a problem for someone who becomes infected with COVID-19. Before we dive into that, please fill our viewers in about your medical background and experience fighting epidemics.
Sure. So after I finished my medical training, I specialized in anesthesiology. I've been doing that since 1982 and just recently retired. When I first came to Canada, I spent a while working on the medical wards, treating patients with SARS. And then in 2003, I was an anesthesiologist on staff in Scarborough. And it's probably that Scarborough was the center for SARS in Canada. And so I was involved in treating SARS patients in the operating room in the ICU in Scarborough General Hospital.
And what was that like?
It was pretty horrible. It's difficult to work in the safety equipment that you need, and wearing a N95 mask during the working day makes life very much more difficult. It's just more difficult to breathe. You just feel constricted. Your face is always hot. You're having to be so much more careful about wearing gloves, washing your hands. And to a certain extent, you felt that you were playing Russian roulette because you didn't know what was going to happen. With anesthesia, I was on call, and so you never knew what was going to come through the emergency department next, who was going to be sick, who was going to need intubating. And there's always a possibility that you might that day meet the patient who infects you with SARS and changes your life.
So explain to our audience what you do as an anesthesiologist, because it's a pretty important position inside the whole healthcare process. You're the last guy people see before you put their lights out.
Yeah, that's correct. So as an anesthesiologist, I'm responsible for assessing people preoperatively to make sure that they're in the best possible the best possible situation to undergo surgery, make sure they have all the appropriate blood work and investigations done. And then I'm responsible for making sure that people are monitored correctly during surgery, that they get the appropriate dose of anesthetic so they're asleep. So we keep them safe and pain-free during the surgery and in the immediate post-operative period. And a major part of that work is the process of intubation, which is where you put a tube down into someone's windpipe and take over their breathing for them. And that's something that's needed routinely in anesthesia, but also it's needed for the care of patients in intensive care who need to be on a ventilator.
And that's exactly what I was going to ask you next. The ventilator and the intubation that needs to happen to have the ventilator work really is a part of what you do.
Exactly, yes, that's the routine part of my life. And during the SARS epidemic, there was a real discussion about who should be intubating people, because normally a routine intubation in the intensive care unit would get done by the intensivist. And nobody really wanted to be the person who has to intubate these patients because it's a high-risk procedure. It's difficult because the risk of spreading infection is so great. You have to wear an extra layer of protective gear. You have to be very concerned about who else is around you, what else equipment you have. And now there are big discussions with intubating COVID patients as to exactly who should be in the room, exactly what equipment should be in the room, what stuff should be in the room outside, immediately available, the best and safest way of intubating these people. And the other thing you have to be really careful about is at the end of the case, you have to be very careful about taking off all the protective equipment because now it's contaminated. And so you have to be very careful about the way you handle all the medical waste that's produced during the procedure.
So this shortage that we hear all about across the world, here even in the West, with regard to the ventilators, how real is that shortage and how critical is that then?
Absolutely. So even in normal times in Scarborough and in other hospitals across the GTA and across Canada, intensive care unit beds are in short supply. And so one of the things I would regularly do as an anesthesiologist is I would call up the intensivist and say, look, I'm about to start this surgical case. I think this person is so sick that at the end of the case, I'm not going to be able to extubate them. They're not going to be able to breathe by themselves. They're going to need to be on a ventilator in the intensive care unit. And if I was lucky, the intensivist would say, yeah, that's fine. When you finish, just take the patient straight to ICU. But more often than not, they would say, well, hang on a sec, we're going to have to move some people. We're going to have to shuffle some things around. We're going to have to make some space. Maybe you're going to have to keep the patient in the operating room for an extra hour or two. And so even in normal times, even when there isn't a flu outbreak, even when there isn't COVID, it's hard sometimes to find a ventilator. The other thing that was happening in my last year or two in Scarborough was that there were times when, even under routine circumstances, the intensive care unit would spread out into the recovery area and use the anesthesia machines, the monitors, and the ventilation equipment in the recovery area because the ICU was already full of ventilated patients. So we're pretty much at or over capacity normally on a day-to-day basis. So the idea that you're suddenly going to have a whole pile of more people who need intensive care and need ventilators is really quite scary. But this is the nature of COVID. COVID is primarily a virus that damages the lungs, and it spreads throughout the whole lungs. It doesn't, like other pneumonias, often only affect part of the lungs. COVID tends to affect the whole lung, and we don't have treatments for it. We don't have a vaccine. We don't have medications that specifically treat COVID. So all we can do is what's called supportive care, which is stuff like intubating and ventilating the patient until their own immune system helps them and gets them better. And so, the rumor is that about 5% of all the people who get COVID are going to need to be in an ICU and on a ventilator. And that's going to be an enormous amount of people. And we don't have the resources.
So let me ask you, and we'll get into a little bit of our position and how we've been reporting on this issue, because we do believe that there has been some form of convergence here, because all of the players that are involved with designating COVID a pandemic and then, basically lighting the world's hair on fire and, driving us straight into a wall, you can't deny the fact that, our economy could be devastated by this action. And so my question to you, as we get into some things here, is that, is this bug as bad as they say it is? And if so, look out, I guess.
I guess so. It's not my field of expertise. So I trust the people in government. I trust the people who run public health. And it's not just Canada's public health people. It's public health people around the world who are saying, that all these steps are necessary. They're saying that it's maybe 10 times more lethal than a regular influenza, that it's probably twice as infectious as the regular influenza. So it's a more dangerous bug. It's a bug that we don't have medication for. It's a drug bug that we don't have vaccine for. So our options for limiting the control of it is very small. And that's why we're suddenly in this unprecedented social isolation, or as people are now saying, physical isolation, social contact or whatever. So this is unprecedented. And certainly I accept to a certain degree, you have to look at the social causes of well-being, right? And this is going to mean that a lot of people are being laid off. A lot of people are worried about paying their rent. A lot of people are distancing from people who are their normal support groups. And so there's going to be a whole pile of knock-on effect on this, both economically and socially and medically. But really, I feel I have to toe the party line and accept that the people who are experts, the people who've spent their entire life studying epidemiology and preparing for pandemics like this, know what they're doing, and what they're saying is what we should do. And
so
to be honest,
that's perfect, right? I want to make sure give you enough time to get that out. So,
and to be honest, I don't see an alternative, because if we do nothing, we're going to be overwhelmed, and it doesn't take much to overwhelm an intensive care unit in Canada, because they're at sort of 99% capacity already. Every one or two extra cases a day is enough to overwhelm most ICUs.
Sure. Now, but we are talking about trillions and trillions of dollars of economic damage, and the kind of poverty that comes from that and dislocation, just even in substance abuse use that goes up, could kill more people than this COVID does. I just don't know whether or not if the small group of people that made this decision were thinking about anything else besides just pulling the fire alarm and shutting everything down. That's all.
Well, I don't know. It's not my area of expertise.
Sure.
And I don't think any of this thing was done lightly, and I don't think this was done without consideration. And I think it is unprecedented, clearly. But I think it is an unprecedented situation. I don't think that we've dealt with a virus this dangerous, this contagious, that is spreading this rapidly. And when you look at what's happening in Italy, and when you get reports from what it's like to be a doctor or a nurse in Italy, it's clearly very scary. And if Canada does nothing, then there's no reason to assume we're not going to go the same course as countries like Italy and Spain.
So I'm going to be devil's advocate here, but
Sure.
but only empowered by public health, because public health for the last 5 years that we've been covering the vaping issue, as we slide into vaping.
Okay, sure.
Yeah. As we've been covering the vaping issue, we have 1,000 people responding to a survey. We have 10,000 people sending in postcards regarding flavors around the efficacy of vaping, as a tool for harm reduction. And every single time, whether in Canada or the US, more in the US though, but definitely you always hear back, well, those are just analogies. We're epidemiology. We deal in population level evidence. And so, but what I'm finding with the COVID thing is just saturated with analogy. Oh, this doctor on CBC said he's canceling his holidays, hair on fire. Italy is still only analogy because it's not the entire population of the earth when we're talking about a pandemic. So, I'm just wondering, nobody seems to be holding people's feet to the fire on the analogy versus, population level modeling and so forth, right?
I'm not entirely sure I understand your question there.
Yeah, that's okay. You're not likely. It was more of a comment.
Okay, fair enough.
Yeah, I think it's more of a comment for sure. Because it's just frustrating, because vapors try to make a point all the time that, vaping is a viable alternative to smoking.
Sure. Yeah.
Vaping is an effective tool to quit smoking.
Yep.
And the last one, which is the big one, is that vaping saves lives. And none of those three things are at all accepted by public health. And indeed, instead of that, except for in England, every time I talk public health, I'm absolutely not mentioning England. They are not.
Okay, fair
they're out of it.
Right.
I'm talking on our continent, and even Canada obviously has a bit of a more rational approach. But I need to cut a big swath here, because we just went through this 18 months from when then Commissioner Scott Gottlieb from the FDA gets up September 2018 and says there's an epidemic of teen vaping, and that epidemic poses a clear and present danger to the health of young people, and that the FDA will not tolerate another generation of young people to become addicted to nicotine. And I've been saying this for a year and a half on air incessantly, that's a massive danger when the world's largest public health agencies, because the FDA and CDC made that call together, if not the CDC entirely. Dr. Gottlieb looked a little stunned when he was making that, and it was 180 from his 2017 approach. But that being said, when the world's largest public health agencies use the language of epidemic and clear and present danger, those are the words they use to quarantine cities, to strip civil liberties, all the things that we see happening right now. And to abbreviate it, 6 months ago, we had the vaping-related lung illness pop up.
Right.
And the
Exactly.
CDC spent 6 months not clearing that up at all. I mean, basically saying that vaping kills.
Yep.
And so I just wonder, why would anyone believe the CDC when their track record as of just moments ago was one of lying about another respiratory illness that was not attributed to vaping?
I agree with you absolutely that the CDC totally failed on EVALI. I mean, it shouldn't be even e-cigarette and vaping associated lung injury. If you're going to call it anything, call it e-vitamin associated lung injury. And their performance on that was horrendously bad, and so bad that it's inconceivable to think that this was just a mistake. That it's the purpose, when there's something bad happening, the purpose of the CDC is to identify exactly what's going bad and to inform people of the risks appropriately. So for example, if there's a bad batch of spinach out there, we don't immediately say to everybody, stop eating all green vegetables. As soon as possible, we say, it's spinach, don't eat spinach. And then as soon as possible after that, we say, don't eat spinach produced from this particular farm, this particular dates. That's the bad stuff. What the CDC said is, don't vape. And they were totally wrong on that, because when finally we got all the evidence is that it wasn't regular nicotine vaping. This was entirely associated with THC cards, and particularly THC cards contaminated with vitamin E. So they did two things wrong. First of all, they didn't appropriately inform the people that are actually at high risk. So they should very early have said very clearly that this is a problem with THC, this is a problem with vitamin E contamination, don't use THC, because that's the specific warning that people need in order that they can make the change in their practices that are necessary to protect their own health. But equally and perversely, they had this whole thing that this was related to vaping, and they were telling people not to vape. And anybody who understood anything about vaping, and pretty much the whole vaping community, immediately said that this doesn't make sense. By this stage, people have been vaping for 10 years. So there's tens of millions of people around the world vaping, including in countries like France and England, where there's a good socialized health system, there's good public health, and if something bad was happening, it could be picked up. So when suddenly you have vapors getting severe lung disease and dying, it's clearly that something different is happening. This isn't regular vapors using regular vaping equipment, regular vaping juices and so forth. Because we know from experience that that doesn't kill people. It doesn't produce this sudden lung injury. So it was obvious to people who understood almost immediately that something else was happening differently here. And I understand that the CDC has to take a little bit of time to make sure it's got its facts straight before it says things. But it was months after everybody else understood that this was vitamin E and THC before the CDC finally said, okay. And it baffles me because, there were smart people, and if they're working with good faith, and if they were trying to present the science and the information accurately to the public, then it's hard to understand how they possibly did what they did. It's not within the bounds of experimental error or differences of opinion. It's just flat out wrong. And so for that, the CDC loses credibility. And the snag is that now they need credibility, right? Because they need credibility when they tell you social distancing, close the pub, close the daycare, don't let kids play in the playground, right? They're asking a lot of people, and they have to have credibility to do that. And as far as the vaping community is concerned, they've lost it because they lied so clearly and blatantly about EVALI that there is a real element of trust. So that's a problem.
So even for somebody like you, who, doctor for decades, you've got obviously predisposed to believe, the most preeminent public health organization in the world. And even for you, there's some doubt.
Very definite doubt. It creases me to say that I think I'm right and the CDC and the WHO is wrong, right? Because, how can you do that without, I need a tin hat and, I need to be reminded that the world is actually round and stuff like this. But both the CDC and the WHO have said stuff about vaping, which is so patently and obviously untrue that you really find it hard to believe that they're actually being sincere and telling what they believe is the truth.
So they're being duplicitous.
I can't find another explanation for it. I'm prepared to give people the benefit of the doubt, right? But there is no doubt to give people benefit of here.
Right. So let me jump over here to there we go. So I'm just showing, and you can see it too, I'm showing our audience just my research software here. This is Zotero, where all of our articles go into before they get curated up to RegWatch or get included in our coverage in some manner or another. This is our CDC file. This is just CDC's postings in here, and it's curated already at some level in here. And excuse me, everybody can see here, right here is when on August 23rd, and this telebriefing here by the CDC is where it all began. And transcript, and this is a telebriefing, severe pulmonary disease associated with the use of e-cigarettes. So this is the first grenade that's thrown in terms of the language manipulation that they've used. And we'll get there in 1 second. I'm going to close us, Doc, here. I'm going to close us right into February 25th, and then we'll pop back to the stuff we're talking about. I'll do this real fast. So here we have the entire start of it, and right off the bat, they know that e-cigarettes have nothing to do with THC. Most people have now know that the CDC knew long before this telebriefing happened that it was THC or, cartridges. There's news reports and stuff like that that say that. And then obviously there is just, a litany here on August 30th, which we've reported on several times, is the the health alert out to the health alert network. And so this went out. This was the first major alert that went out across all of the United States. And in it did, of course, e-cigarettes. And then we'll get into the mays and coulds and should in a second. I don't get too far off on this. But anyhow, so this is the one that got sent out and went everywhere and did not ask for any testing. Zero testing. So we're in the middle of what they're pinning as a national epidemic built on top of the youth vaping epidemic. This is an outbreak of vaping-related lung illness, and they don't even ask any medical professionals in the country to do any testing, just ask the teens to self-report. And I'm not going to comment on that.
So just to be clear what you're saying, they should at that stage have asked for blood tests or urine tests for THC. And clearly they should have done that. And they eventually got around to it, but they took a long time.
Yeah. So, I mean, what should they have normally done?
Well, I don't know that you can have any normal in here, right? But
okay,
if you're looking at a new disease or an epidemic of something or an outbreak, you begin by casting a very wide net and you look at everything. And the possibility of contaminated THC, contaminated illegal substances had to go in there. And they should have been testing these people for all drugs. They should be doing a tox screen on everything.
Oh, I totally agree. There's no doubt on that. It was glaringly absent. And then as we run through, again, it's just, incessant. Every single day from August until, I would say, probably early December for sure.
Right.
Every day, new cases of vaping-related lung illness as the number goes up. And then new deaths. And that was just constant, incessant, all the way up to the end of the new year.
And the media lapped it up. And the media would often say, this is a vaping-associated lung injury. And then at the bottom in small print at the very end, oh, by the way, this patient was also using THC.
If you were lucky. If you were lucky, you got
if you're
that.
Lucky, yeah, exactly, yeah, if you were lucky.
Yeah.
So the reporting was, to be charitable, lax, right? To be more fair, incompetent or negligent.
So I want to just remind everybody, we're talking about just moments ago, right? Like this is moments ago. So we head through October. So by October 4th, FDA has said, whoa, wait a minute. We actually have a few people here that have science still in their brains in a proper way. And they went, whoa. This isn't nicotine vaping. This is illicit THC black market vaping. That was on October 4th. FDA said, that was it. CDC stuck right to it and just kept pushing it through the media. And the media was just happy to take it. And they just went over and over and over again. And we know what happened. I mean, national vaping bans, it went so high up. They had the president of the United States believing that vaping kills. I'm certain of it, right? And that's, what was happening there. So the long and short of this whole story, which is just a gross, horrible story, is the fact that we get into the new year and it's January 17th when CDC finally does a mea culpa in their, news briefs. Remember, they do these telebriefings bi-weekly on issues, sometimes every week on others, all these news releases that go out, and it's just jacked right into mainstream media. And so on the 17th of January, CDC comes out, most, just they can't even give you truth at all. I mean, that's so mendacious. It's just like, Most EVALI patients used THC-containing products as new cases continue to decline. Small percentage of cases reporting non-THC product use needs further study. It's just they should be. CDC today released 2 reports on e-cigarette or vaping product use associated lung injury, EVALI, confirming that most EVALI patients report using THC-containing products and that new EVALI cases have continued to decline with time. We're going to get to EVALI in a sec when we get to our language part. So they clear it up a bit, but they never really do exonerate traditional nicotine vaping. To me, it's kind of like making a claim about somebody in, like in the hall of a legislature where you can never be touched for what you say. Yeah. A complete total smear. Like you basically say, Brent Stafford is a serial killer. By the way, I'm not, but you can take that and use it all you want. But, and that's done from inside, the legislature. Well, I can't sue for defamation. And so in this particular case, they just won't even clear up their own assassination on the virtue of vaping. We call it the virtue of vaping. They've assassinated the virtue of vaping. This is January 17th. So final bit on this is really the kicker, because obviously COVID had already broken in December in China. Don't think for one second the CDC didn't know anything about it. The CDC is the one that set up China's CDC in the 1980s. The CDC set up CDC-like operations in 60 countries in the last 5 years in the effort to fight future global pandemics. It's all run out of the CDC. The WHO's pandemic programs run out of the CDC. It's funded by Americans out of the American general budget. So, I mean, they just upped it again just a year and a half ago. So we are talking about the same people who lied about vaping, who lied about the epidemic, who lied about vaping-related lung injury, are the same ones that pulled the fire alarm on the world's global economy and complete total disruption of everyone's lives. We have no idea what the ramifications are going to be from that, but we know what the hysteria looked like for the last 6 months, just the last 6. So on February 25th, and this is the kicker, on February 25th is the day that the CDC closed the book on EVALI. CDC states update number of hospitalized EVALI cases and EVALI deaths. So this is where they announced, the CDC today announced the updated number of hospitalized e-cigarette or vaping product use associated lung injury EVALI cases and EVALI deaths. As of February 18th, 2020, and that's last month, folks, 2,807 cases of hospitalized EVALI or deaths were reported, all 50 states, due to continued declines in new EVALI cases since September 2019, and the identification of vitamin E acetate as a primary cause of EVALI's today's release is the final bi-weekly CDC status update on the number of hospitalized EVALI cases and deaths. So the CDC has closed the book on EVALI on their great lie. And then on the exact same day, and let me just reiterate, on the exact same day, they published this transcript the next day, so that's why it says 26. On the exact same day as they closed the case on EVALI, they did a 2-hour telebriefing at the CDC and pulled the fire alarm on COVID. And it was the CDC people that did this. There was nobody in the administration that approved this. They just went on and did what they normally do, and they just lit a fire. And so you're a bit familiar with that, Dr. Oyston. Let me put this back to you, and I thank everybody to kind of put up with that. It's really hard. I mean, how do you really capture the Machiavellian aspect of that? I mean, do I have a tinfoil hat on for pointing this out?
No, not at all. But I think you have to differentiate between the disease and the people who are communicating about it. EVALI was a genuine thing. It killed, I think, 500 people in the end. And in the end, people got to the root cause of it and eventually said, yeah, this is something to do with vitamin E, contamination of THC. So the disease was there and it was real and it was investigated. the communication around it was appallingly bad, inexcusably bad. But that doesn't alter the fact that it existed. And the same thing with COVID. COVID, the disease does exist. It does kill people. It does spread. It is a problem. It's a global problem. And you may now not trust the CDC as much as it would be nice to trust the CDC. I understand that. You may query about the exact date on which they spread the alarm, but the disease still exists and it's still killing people and it's still spreading and it's going to kill more people.
Right. And I mean, obviously the disease exists, the virus exists for sure. Right. No doubt. Yeah. That's not the issue. Yeah. And the timing of it is only an issue because of state of mind. Okay. So you have, and if the day before, COVID became this, right, and you were to evaluate the CDC, and remember, it's not just the CDC, because of the preeminent organization, it spins all the way down through public health, foot soldiers, right? And you're fighting it on the local level with the local media that are getting hit by the local body part orgs and by the local community public health people it is literally an army of public health people. And it all does come right down from CDC. It certainly does. And then, of course, we have countries across the world that, responded to the hysteria over vaping-related lung illness, and they banned vaping altogether in their countries. Right. Yep. Yeah. So we are talking about a spun-up global hysteria over the epidemic of teen vaping, which rolled right into E-Valley. And so my question is, this is state of mind, because they've certainly had hysterical, maybe not totally CDC, because they might be a bit more, anyhow. But the fact of the matter is that the story they spun certainly flourished hysteria across, right, all the way down the line, right? So what's the state of mind that they have when they go from that to COVID without a breath?
Right.
Okay.
You're trying to put these two things together, and I'm not sure that this isn't just a coincidence. Nobody chose the timing for this epidemic to start.
So we can expect then hysteria at any level. So it's not a vape, it's a vaping related lung illness, but everybody who knows anything, even tons of people in public health, do not recognize it as. And so let me just say, I get it. But the fact is, though, is that there has to be some modicum of response, right? We have to trust that they're going to have some thinking about the response. That's all.
Right. Yep. I don't disagree with that. I think the knock-on effects from what is happening now in terms of the health illnesses, from being unemployed, from not being able to speak to your relatives, right, to kids not going to school, the downside of this in the long term is enormous. My investments have taken a hit. I'm sure yours have as well. So there is an enormous problem here. And it would be nice if we had more faith in the CDC than we do. We have, the vaping community certainly has very strong reasons to doubt not only the veracity, but perhaps even the goodwill and the good intentions of the CDC. I don't know that we should necessarily extend that to everything that the CDC does in every other field of endeavor.
And that's fair. But it is astonishing, though, that we are at the point where the world's preeminent public health agency that right now is triggered a global shutdown, that we're even talking about that there might be some issues. Let's jump over to the news media, Dr. Oyston, because we've spent some good time. I'm hiring you as a curator for RegWatch, and trust me, it doesn't pay a lot, but so we've got the coronavirus updates from NBC News. So this is curated at RegWatch. Vaping, one of the best ways to trash your lungs and maybe die if you catch coronavirus. So this was published yesterday by MSNBC. I don't even know much more to have to say, except for, there's the headline that NBC has pushed out through their thing. What do you make of that?
This is so far off base, it really isn't even funny. certainly you can demonstrate that there are things that vaping does that are bad to the lungs, right? Vaping is not good for your lungs, but the amount of harm that vaping does is very small, and it's particularly very small compared to the amount of damage that cigarette smoking does. And whether you accept Public Health England's figure that vaping is 20 times safer than cigarette smoking, or whether you think it's some other number, clearly vaping doesn't contain all the poisonous chemicals and the many carcinogens that are present in cigarette smoke. But it's a whole par more safe than cigarette smoke.
And it says here, just to point out as we'll conversation mode a little bit more here, and thank you for bearing with, vaping injures the lung tissues. Is that true?
It does a little bit, like, I mean, it's you can certainly produce evidence that there are things that vaping does which isn't good for your lungs. So, but the thing is, you have to make the comparison with smoking, right? And there's plenty of evidence that smokers who switch to vaping, their lungs get better. And that's both anecdotal evidence from thousands and thousands of people who've done it, right, and who've reported, I was less likely to get flu, for example, after I switched to vaping from cigarette smoking. That my COPD got better. And there's research by Riccardo Pelosa from Italy saying that COPD gets better, you have fewer asthma attacks. So although vaping probably does some small amount of lung damage, it does a hell of a lot less than smoking. And for smokers who switch to vaping, there are very real, very serious health benefits.
So as a doctor then, in the midst of the COVID crisis, what's your advice to vapers? Do they have to stop, or can they vape with some assurance, confidence, I guess, that they'll be okay?
We really don't know, okay? Because people are making all this stuff about vaping will make your COVID worse. And they're doing that completely in the absence of any scientific evidence, right? There is no scientific literature anywhere in the world that specifically addresses the question of, do vapers suffer worse from COVID than other people? That has never been studied. We don't know. And you can theoretically argue that they might be worse. And the nearest I can find to an article that suggests that is there's a mouse study saying that mice who were subjected to vape and then exposed to influenza virus did worse than mice who were not exposed to vape. So,
and that's right. We've got that. It's not as fun to show that one. That's the older one from 2015, correct?
Right. Yeah. And so that's probably been something, right? But it's mice, and it's influenza virus, not coronavirus, and also, they didn't have a group that was smoking, right? I'm sure that if they had a group of smoking, those people would do even worse. The other thing which is really interesting is that vape juice contains propylene glycol. Most vape juice is about 50% propylene glycol. And that actually has antibacterial and antivirus properties. And there's a couple of papers going back to the 1940s in which they're actually spraying propylene glycol in hospital wards as a way to prevent the spread of infection. And so there is an argument that propylene glycol actually kills viruses. It certainly kills influenza virus, and it reduces the spread of influenza virus. So if you're going to tell me from one set of studies in mice and influenza that propylene glycol and vaping makes it worse, I can come back at you and say, well, actually, maybe it makes it better. I mean, it's not crazy. And I'm not saying that as soon as you get COVID, you need to start vaping with propylene glycol because it's going to cure you. But I am saying that we genuinely don't know. We have no proper scientific evidence for any relationship between vaping and COVID, and it could go either way. So if you're vaping now, particularly if you're vaping as an alternative to smoking, keep on. For God's sake, don't go from vaping back to smoking. That is absolutely a crazy bad step. And we know with Avali that some people did that. They were so scared that vaping was going to kill them immediately that they figured, well, we go back to smoking and have a slow death. So we have to be very careful about what we say, because certainly for the people who are vaping as an alternative to smoking, they are doing the right thing, and they need to continue doing the right thing, and they don't need to worry that this is going to have really bad effects on their, if they get COVID.
Okay. Well, and we're going to take a quick look here too, as well, at some more of these stories. But first, I want to just mention to everybody that if you do get a chance to please go to support.regulatorwatch.com. And that's our support website, where you can go as a viewer and kick a few dollars over to us, either monthly or one at a time. either way, it would be most appreciated. We are obviously, well, we're fan funded, we're small industry funded, and, you know, obviously we work with some big companies too, and everybody is hurting. That was happening. I mean, public health has just been bashing this industry so hard for now 2 years. It's amazing anybody is still in business. Yeah. But I got a feeling that, of course, that vapors will prevail. But so please go over to Regulator Watch, support.regulatorwatch.com. And then here you can jump in and see some of our coverage. We do actually have a good overview of our coverage up on the site, and you can use our easy support tools and then join some of the great companies that are helping us make this content happen. And that's Demand Vape is our US anchor supporter. This piece, Stealth, Divine Laboratories, and of course, there are a whack of other great Canadian companies and US companies that have been happy to help, and individual contributions too as well. All right, well, that's the pitch for us. So, Doc, have you ever recommended vaping to a patient?
Yes.
Do tell.
And in fact, for a while, I was trying to set up a business. I have a website, Quit by Vaping, and this is one of my retirement projects, because since 2006, I've been very keen to get people to stop smoking, and I've been involved with various initiatives to reduce smoking. And in the last 18 months, I've been very interested in vaping as a way to get people to stop smoking. So I like to say that I'm not pro-vaping, I'm anti-smoking, but I see vaping as a tool to get people away from cigarette smoking. So I've actually been trying to set up a business to running a course for vapers who want to use, say, for smokers who want to use vaping as a way to quit smoking. But my timing of this has been just unbelievably terrible, because first of all, there was the Holy Valley crisis, and nobody wanted to talk about vaping in any way, shape, or form. And now we have all this social distancing, and I can't gather people together and have a little discussion about, how they should switch from smoking to vaping. So at the moment, I've had to put that whole thing on the back burner. It's one of many small businesses which is currently suffering from the COVID crisis.
Well, geez, that's tough. But what an interesting idea to do that. And coming, not that there's anything wrong with psychology or in psychiatry or any of the other kind of counselor kind of positions. I mean, you're like what we call on RegWatch a doctor.
Right. Yeah.
Oh, there you go. So, all right. Well, that's good. And then you've got, what's the other, let's do your other websites here right now real quick while we're on that, on the theme.
Not sure. I have a blog. This is johnoyston.com. And that was a general interest blog, but over the last 6 months, it's been taken over by discussions about vaping issues.
Sorry, it's johnoyston.com or is it oyston.com?
Oyston.com/blog is one. You can also get it to it from johnoyston.com. They come to the same place.
Got it. There we go.
You've given oyston.com.blog. So oyston.com/blog.
Excellent.
Yeah, there we go. That's it. Yeah, so I've got something there about various issues about vaping that have concerned me lately. I've also been active on YouTube. I produced a video called The American Lung Association Lies, calling out the American Lung Association for some lies that they were telling about vaping, because they actually said on their website that vaping is smoking, and switching from smoking to vaping isn't quitting smoking. And they spread the whole popcorn lung myth and a whole pile of other things. So I had a bit of fun just pulling that apart, and I created a YouTube video that had, I think, 3,000 hits in the end.
Excellent. Fantastic. Yeah. And, more competition for us, the better. Is all I can say.
Right. Yeah. Okay. Yeah.
So let's hop over to the rest of our list here.
Yeah.
And can you see? Yes, you can see. Good. Just making sure there.
Yeah.
So experts question whether vaping epidemic is behind younger adults being hospitalized with coronavirus, as it's revealed that smokers were 14 times more at risk of their illness becoming severe.
Yeah, so this is weird, isn't it? So we're switching from, because smokers are more likely to get severe COVID, then vaping causes COVID? Like just looking at the title there and following the article, it's kind of hard to follow the logic, right? So we do have some evidence out of China that people who cigarette smoke are more likely to get COVID. and also that they are more likely to be severely ill. The data I have, I think, was 2.4% more likely to have a severe outcome, which was basically ICU admission, ventilation, or death. And this totally makes sense, right? Because COVID is actually a virus that basically kills by giving you pneumonia, and that's like the mechanism by which it causes death. So cigarette smokers have poorer lungs, they have less lung reserve, they have chronic lung disease secondary to their cigarette smoking. So it's totally unsurprising that they would end up with worse outcomes if they get COVID. So I think that's reasonable, and I think COVID is a reason why people should think about stopping smoking. Like, there's never a bad time to stop smoking, but at the moment, this may be a good time. And it may seem perverse because I know that people are very anxious and very upset. And for some people, cigarette smoking is a way they deal with anxiety. It's something that they use to relieve their stress. And for the next little while, I'm prepared to give people a free pass on that. But for other people, when they try to quit smoking, it's the social pressure from other smokers that makes them fail. So it's a very common story that someone tries to quit smoking, they quit smoking for 3 or 4 days, they go out with some friends, they have a few drinks, someone hands them a cigarette, and they get back to smoking. Or they have a bad day at work, and some of their smoking friends at work say, okay, let's all go and take a smoke break, and then we'll get back and have another go. So social pressure from other smokers is a reason why many attempts to quit smoking fail. And now we have this unique situation in which people aren't going out with their friends anymore, and they're not meeting up with their co-workers in person. So for some people, this may be a good chance to quit smoking. And when you quit smoking, different things get better at different times, right? So for example, carbon monoxide is a poison which is present in cigarette smoke, not present at all in vape. It has a half-life of about 4 hours. So that means if you stop smoking even for 12 hours, your level of carbon monoxide in your blood goes back down to normal. And that allows the blood to transfer oxygen to the different parts of the body. And it's probably important in treating infection. For your lungs to get better, and we know this from anesthesia, it takes about 4 weeks. So this is one thing I've been involved with. I had a program called Stop Smoking for Safer Surgery, and I wanted people to stop smoking 4 weeks before elective surgery, because that's enough time that your lungs improve and you halve the incidence of lung complications and infections after surgery. So it's reasonable to assume that if you were to stop smoking now and you got COVID 4 weeks or more later, you would do better with that COVID episode because you quit smoking. And it seems COVID is going to be around with us for a long time. Some people are saying 12 weeks, some people are saying October or whatever. So COVID is going to be around for a long time. And if you're a smoker now, then I would seriously say, think about it. Is this something that you could do at the moment while you're changing so many of your other habits? Maybe you could quit smoking.
Well, I think that some of what you're saying there is baked into the cake a bit, because allow me to just mention the fact that, part of the progressive public health movement is, social engineering people to become better, right? That's the whole nudge thing about it, right? So you're making a valid argument for utilizing a total disaster to your life to, potentially nudge yourself over to quitting smoking. I don't know if you're going to get a lot of buyers on that one there, Doc.
I'm putting it out there. Any chance I get to promote the idea of quitting smoking, I put it out there, right? And because it's so important. It's the best thing you can do with your health. We know that maybe half or 2/3 of all smokers end up dying from smoking-related illnesses. And in terms of what can you do to prevent yourself getting COVID or to increase your chance of survival, okay, all the social distancing, the hand washing, all this stuff is all important. But I think there's a reasonable argument that stopping cigarette smoking is up there somewhere.
Well, you're right. When you're isolated, considering the fact that one of the hardest things about quitting smoking is that, you're used to going out drinking with the buddies, and smoking and drinking always go together quite well, and smoking and eating and everything else. So if you aren't doing any of that, it might be easier.
It might for some people.
Yeah. Well, that does make some sense. No doubt. I know that the social impact of quitting smoking is always one of the toughest things.
Yeah.
So I quit drinking in 2012, and you'd think that was hard. In the end, everything was about smoking. It was how hard is it going to be to quit smoking? Smoking was the one that was. I actually changed my entire eating habits before I even tried to quit smoking. I peeled off 35 pounds.
Right,
before I
good for
tried to
you.
quit smoking
Yeah.
because I knew I would have just been toasted if I had done any other way. And then, of course, vaping was I didn't quit smoking with vaping. I quit with Chantix, and I went out of my freaking mind. And I happened to have
Right.
like a first
Yeah.
gen
That happens to
pen
people.
in the drawer. Yeah, it totally happens to people. And I had a first gen pen in the drawer, gave that a shot. And because it had been so long since I'd had, about 3 months, 2.5 months or something on that Chantix stuff, that I hadn't had any nicotine in me, I actually felt the nicotine from this vaping device that I never could have felt before as a 2-pack a day smoker. I was a
Right.
2-pack a day smoker for 15 years, another 10 at about a pack and a half, something like that. So when I was looking to quit smoking, any kind of vaping device that I tried just didn't give me enough of a nicotine hit. This was obviously way before, sometime before salts.
Yeah.
Yeah. So, okay. So let's, what do you think is next then here for us? I think we could keep diving into some of the crappy, bad news and horrible media coverage, but everybody knows what that is. Do you have some advice for the vapors that are out there who have to deal with all of this still, happening every day in terms of all these bad things that they're saying about vaping? Is there anything that you could, give them advice on to help manage it?
I think you have to totally ignore a whole pile of the stuff in the media. And every time you see something that says anything bad about vaping, you have to say, okay, what's the comparison, right? Because if it's not a comparison with cigarette smoking, then it's not relevant to you as a smoker, right? So ideally people shouldn't smoke and they shouldn't vape. But if you're in a situation in which the only way you can get yourself off cigarettes and stay off cigarettes is by vaping, then definitely you should do that. And it's a whole pile safer, and you need to stick with that program. And if you see this thing that says, vaping can cause cancer in mice, okay, sure. Can cigarette smoking cause cancer in mice? Yeah, sure as hell it can. You see this stuff that's saying, well, vapors might do worse if with COVID. Well, they might, but for sure as hell, we know that cigarette smokers do worse. So you just have to let a whole pile of stuff sweep over you. And it's amazing how much legs some of these rumors have. This whole popcorn lung thing, right? The idea that vaping will give you popcorn lung is like a total myth. It's never happened. There hasn't been a single case of popcorn lung during vaping. And yet everybody you speak to about vaping sooner or later will bring up popcorn lung as if this is, as if the wards are full of people with popcorn lung.
It's quite astonishing. And then in the fall, during the midst of the vaping-related lung illness, of course, there was one indication of potentially maybe another. And let's talk about that, because there are incessantly, they use may, could, right, potentially.
Yeah.
What do you make of that?
Are we talking about the CMHA case?
We're talking about every case. I'm talking about the grand poobah case of like the Stanton glances, just, right, snarling out crap. Pardon my expression, but snarling out crap with a may and a could and a possibly and a potentially be right there. And, the journalists, they write that potentially and then don't care that it just.
Yeah, so certainly Stanton has got a lot of attention lately because he wrote this blog article talking about COVID. And I think every journalist wants a new angle on COVID. And so the sports journalists are saying, how do you create a gym out of stuff in your home if you're in isolation or whatever? So Stanton wrote an article which was almost entirely fact-free, that sleight of hand and mixing around and may and could and possibly and whatever, was saying, that maybe, people would do worse with COVID if they vaped, and everyone should quit vaping right now. But, without any actual evidence. I mean, he quoted the article I talked about the mice and influenza. Yeah, and Bill de Blasio, the same thing. He has no evidence to say what he's saying there. He's just producing this out of thin air. And it seems like it's open season on vapors, right? And anybody can say anything bad about vapors they like. And that's how you get headlines.
But it seems something more like.
He said can increase the risk of coronavirus. There's no evidence that it can do that. It may possibly. It probably doesn't. It's more likely that if you get coronavirus and you vape, then maybe it'll be like 2% worse than if you didn't vape. that's a reasonable thing to suggest. But it probably doesn't increase your chance of actually getting it.
So you've spent a lot of time here on our show, making sure you're careful with what you say, because you're a man of science, you're a doctor, you're responsible. So if you can do that, and if you can put that together in your head about what's the right, responsible way as a medical professional should handle yourself in public, how does it explain de Blasio, Cuomo, Michigan governor, all the Democratic governors, all the Democratic senators that sign the Senate things every month?
Right.
How can you explain that? How can they not have that same level of approach that you do?
Well, honestly, I think a lot of it is I don't have any money on the table here. Like I'm not being paid to do this. I'm not being paid by tobacco. I'm not being paid by vape. It doesn't really matter to me financially, any of this stuff, right? This is stuff I'm doing because as a physician, I feel that I have a responsibility to do what I can to look after the health of patients. And that's where I'm coming from. And I came to vaping with no preconceptions as to whether it was a good thing or a bad thing, right? I want to get people to stop smoking. And when you look at things that can stop people smoking, vaping is certainly something which I believe and works. And I think that it reduces the risk for people, even if they continue to vape and they never actually quit use of nicotine. I think that for adults to use nicotine is in the same sort of order of adults using nicotine, using caffeine or using alcohol. I think it's a totally acceptable thing for people to do on a regular basis.
When we were doing our pre-interview, you said something. We were talking about the CDC. We're talking about what could be their motives for lying through Valley.
Sure.
And you were struggling there to figure out, well, could it be tobacco money that was CDC or farm?
And I still am. Like when I did the thing about the American Lung Association, it was fairly clear that one of the big donors to the American Lung Association is the Johnson & Johnson Foundation. Johnson & Johnson make a whole pile of the traditional nicotine replacement and smoking cessation medications. And so it's not hard to say that if you get $100 million from the Johnson & Johnson Foundation, then you have a reason to be concerned about vaping, because that is taking money away from them, right? In Britain, where vaping is the commonest way to get people to stop smoking, prescriptions for the traditional non-smoking medications have gone down by 70%. So I'm fairly comfortable tying a link between Johnson & Johnson and the money they donate to the American Lung Association and the American Lung Association stance on vaping. If you look at the World Health Organization, they are very heavily funded by the Bloomberg Foundation. And Bloomberg has very strange views about nicotine, which are not based on fact. And if you look at the organization of the World Health Organization's tobacco control strategy, there's this whole little thing off one corner, which is Bloomberg. So clearly, to a certain extent, Bloomberg has bought the WHO, and the WHO, to a certain extent, reflects his beliefs about nicotine and about vaping. With the CDC, it's a little bit harder to understand where that is coming from. Now, one of the things I used to do is I used to work with a group called Tobacco 21, which in the States was trying to raise the level for buying tobacco to 21. That's the thing with Bloomberg. And they were totally blatant about it and totally upfront about it and totally clear about it. They said big tobacco has bought the American government. They said big tobacco has bought the federal level of the government and it's bought the state level of government. And the only way we're going to get the law on tobacco changed and the way the legal age raised is to work from municipalities and states, because big tobacco hasn't actually bought, not the states say that, from municipalities and cities and towns, because those haven't been bought by big tobacco yet. And that's how they did it, or at least that's how they started it. And they worked their way through city by city, town by town. Yeah, and exactly. This is so Bloomberg is spending $1 billion to fight tobacco, and he thinks with $160 million, he can basically buy state legislatures, buy city legislatures, and push through this ban on flavored e-cigarettes. It's interesting that his attempt to buy being president of the United States failed. So there's some limit on what you can buy with money, even in America. But clearly, he thinks that he can, buy state legislatures.
That is true, and it's ominous I mean, there's so much money that is marshaled against vaping.
Yeah,
It's amazing.
and the thing is, I really think that vaping could be an existential threat to the whole tobacco industry. If you look now at the kids who vape, aren't going to smoke, right? And while some people talk about it being a gateway, it's not. It's more like an inoculation. Like if you own a Juul, you're not going to want to smoke a cigarette. A cigarette is crap compared to Juul, right? It's smelly. You have to find an ashtray. You have to put the ash somewhere. You have to find a lighter. You can't hide it. Everybody knows what you're doing. Your hands smell. Your clothes smell, right? Why would anyone smoke if they own a Juul? It's like owning a Ferrari and deciding to take a pony ride. Um, so I think that tobacco is very, very concerned, and tobacco has a hell of a lot of money, and a lot of that money then flows through into American government. Particularly through, for example, the master settlement agreement with the states. A lot of the states, like California and New York, are dependent on money from the master settlement agreement, which is a proportion of the amount of money that tobacco makes. And so if tobacco starts making less money, states like New York and California suddenly start getting less money. So when those states in particular start going on about vaping and about Juul and about flavors and stuff like that, they're protecting their tobacco money.
And that's certainly true. It's a complex web of interests that look to kill vaping. There's no doubt. So inside here, with the COVID crisis,
yep,
over the Wuhan virus, because it's from China, I want to just make sure that I mention that there are some efforts going on to classify vaping as an essential service.
Yes.
And so CVA has come out and called on Canadian governments to ensure adult access for vaping products, because we are entering more and more into lockdown phase here, which is essentially house arrests.
Yeah.
And then we've got in Europe a good friend of our show and a great scientist, Dr. Ricardo Pelosa, got involved as soon as he could, responded to it. This is a great story by Helen Redmond. It's been on the show from Filter Mag. You can find it on regulatorwatch.com. Just go to our COVID-19 CV19 section and you will find it. And then so they made great efforts there to get vape shops. They were originally they were originally included, but now are exempt. So they're now exempt from the lockdown, which is great news. And then on your side, you two as well have actually put some pen to paper too. Tell us about that.
Yeah. Okay. So for smokers that have quit and are now vaping, vape shops are an essential service, right? Vaping is medicine for these people. And if they don't get access to their vaping supplies, then many of them are either going to have to find illegal backstreet vaping supplies, which gets us back to the Holy Valley stuff, or they're going to go back to cigarette smoking. So during this crisis, nobody is talking about closing down all the tobacconist shops, all the convenience stores, all the gas stations, all the places that sell cigarettes, right? So without question, cigarettes are going to be available during COVID and people are going to be able to buy cigarettes. If people are going to be able to buy cigarettes, then people who have quit and are going over to vaping should be able to buy their vaping supplies. And the Canadian Vaping Association reckons that there are about 1 million vapers in Canada who are reliant on adult-only specialty vape stores to get their vaping equipment. And a couple of things they point out, which is quite interesting, is that now the post office will no longer deliver vaping supplies because you have to have a signature to prove that you're over 18. And understandably, the post office doesn't want to have their people standing on the doorstep having conversations with customers and getting their signature. So you can no longer buy vape stuff and cannabis and other things that require signatures available through the post office. And the convenience stores have been taken over by big tobacco, and they tend to sell tobacco, the stuff that's associated with big tobacco. And those things tend to have very, very high, unnecessarily high nicotine concentrations. So the vape stores sell a whole range of nicotine concentrations, both high and low. But if you want to get access to the low concentrations, you have to go to a vape store. So clearly, if we're still allowing people to buy tobacco, we should allow them to buy vape supplies. And they should be in the same category as pharmacies or whatever. They're basically providing medical stuff. And so far, from what I know, Ricardo Pelosa managed to get this passed in in Italy and in France and in Greece. And there was a tweet from Martin Dockfall, who's the tobacco control lead for Public Health England, applauding this and saying that Britain needs to go the same way if Britain gets to this level of lockdown. And certainly Canada needs to do the same thing. And so I've been writing to health ministers and various other people who have maybe some influence in this, saying, that if we get to a stage where only essential services are allowed to remain open, then vape shops should be counted amongst those essential services. I'm not sure how that's going. The one place I know, Illinois apparently has decided that vape shops aren't a special service, and they've closed all their vape shops, along with their hair salons and other places.
Right. Well, Martin and Public Health England certainly know what they're talking about. That's for sure.
Yeah, exactly. Yeah.
Yeah. Now, as we're wrapping up here, let me ask you this, and this really is the last thing, is what's your message to Health Canada and to the governments, provincial governments here in Canada with regard to vaping during the COVID crisis?
Yeah, I mean, sadly, the vaping is now, COVID has now taken over the whole public health issue, right? There is nothing anybody in public health is dealing with except COVID, I'm sure. And that's entirely right, and that's entirely responsible. And so vaping has to take a back burner. But what they need to do is to maintain more or less the status quo at the moment, right? So keep the vape shops open, allow people to have access to adult-only vape shops, and we'll come back and review the rest of it later. There was a whole pile of hope that they were going to be relaxing the restrictions about what vape store owners could say in terms of promoting e-cigarettes as a way to quit smoking, particularly after Hayek's study, which showed how effective vaping is as a way of quitting smoking. So there was a whole pile of things that were happening that were hopefully moving in the direction of allowing vape shop staff to be more honest with their customers and provide more information with customers about the benefits of vaping. So hopefully, once this is all blown over, they'll get back to that and we can get back on track.
And that would be the hope, no doubt. Well, Dr. Oyston, thank you for joining us today on RegWatch.
Thank you, Brent.
And good luck over there in the East. We've got the West. Maybe they'll have two different kinds of bugs. So, but I hope I hope everyone's going to be safe. Thanks again.
Yeah. Okay. Thank you very much.
Well, that's it for this edition of RegWatch. Before you head off, please go over to support.regulatorwatch.com. That's support.regulatorwatch.com, and consider making a financial contribution to our vaping coverage. It's easy. Just dig into your wallet and find a few dollars and toss them over our way. You'll be happy you did, and so will we. And cough all you want all over if you send cash. I'm a conservative. I'll be fine. And while online, don't forget to like us on Facebook and to follow us on Twitter. For regulatorwatch.com, I'm Brent Stafford.